Migrant workers will soon get easier access to affordable medical help under a new primary healthcare system. 4 operators have been appointed to run regional medical centres across the country. A new care plan has also been launched to keep prices affordable. Chua Tian Tian with this report.
The COVID-19 pandemic has put the spotlight on the need to enhance medical support for migrant workers. Going forward, the Manpower Ministry says it's taken concrete steps to set up an integrated primary healthcare system for them. For one, it's appointed 4 service providers to run medical centres in 6 geographical regions in Singapore. Migrant workers will be automatically enrolled with one of these anchor operators depending on where they reside. StarMed Specialist Centre will operate a medical centre at Farrer Park. Satacom Health will be in charge of 3 medical centres in the north and eastern part of the island, as well as 2 centres located within dormitories. Fullerton Healthcare Group will run 3 medical centres, while St Andrew's Mission Hospital, an NGO, will manage a centre at Pendrew. The centre is part of a public-private philanthropic initiative called Project Migrant to uplift the well-being of workers. And the medical centre will serve 57,000 migrant workers alone.
Our anchor operators will ensure that care is delivered in a way that minimizes language and cultural barriers for our migrant workers. Besides having IT-enabled multilingual translation capabilities, anchor operators will also have the opportunity to augment the clinical team with healthcare workers who can speak the native languages of our migrant workers.
Employers can also buy a new primary care plan to cover their workers' healthcare costs. The annual plans range from just over $100 to $145 per worker. Workers will co-pay $5 for each visit to the medical centre. However, one non-profit organisation hopes these centres can provide more services like dental and vision care.
A vision problem is quite dangerous for a migrant worker because they're actually doing so much physical labor. If they can't see something and they end up hurting themselves or hurting somebody else, those are all avoidable situations which can just be cured with a pair of glasses.
More details on the implementation of the new healthcare system will be released next year.